You guys just gave an amazing update of clinical updates in addiction medicine. And I think my first question for you guys is, we know that the X waiver, which was required to prescribe buprenorphine, has been eliminated. So I was wondering if folks could talk a little bit more about that and what this means for all the primary care docs listening.
All right. Well, thanks for that question, Carolyn. I'm Kenny Morford. I'm a general internist and addiction medicine physician. And this was exciting news for us. So in December of 2022, Congress passed the omnibus bill, and that included something called the MAT Act, which is the Mainstreaming Addiction Treatment Act, that announced the immediate elimination of the X waiver for prescribing buprenorphine for the treatment of opioid use disorder. So what that means is that for any practitioner who has a DEA registration that has Schedule III authority, they can now prescribe buprenorphine for OUD if permitted by state law. So that's an important caveat to this, is that there are certain states where they still have training requirements. And if those are in place, then that will kind of take precedence over the federal law. But with that said, some other things that are important about this MAT Act. So anyone with a DEA registration can prescribe bup. It also means that these other federal requirements are out the window. So that includes discipline restrictions, patient limits. It used to be a 30 patient limit for how many prescriptions of buprenorphine you could write, as well as provision of counseling. So that used to be a requirement to prescribe buprenorphine.